Take care of your neck. But why? Why is it so important? You know, it's a simple enough message, but why do so few people seem to do it? And you might have seen that there's a lot of videos that are out there on TikTok, YouTube, Instagram, all the social media, talking about how a problem in the neck can be related to headaches, migraine, vertigo, dizziness, chronic fatigue, fibromyalgia, low back pain, any number of different things in the body, to the point that it almost seems too good to be true. Well, guess what? Reality is it is. Because there's not one magic silver bullet. There's nothing that fixes everything in the body. We have to deal with stress, sleep, diet, exercise, body movement. And when things start to go wrong, that can show up as tumors, infections, changes of our physiology, changes in hormones, all kinds of different things that we have to sort through. But what I want to take are just a couple moments to explain why it's so important to take care of your neck, because it has such a profound influence on all dynamics of your health and well-being. You know, if we were to rewind the clock 100 years, the idea of going to a dentist was quite crazy. People only did that if they needed a tooth pulled, something like that. But we know today that if you've got a small problem in your mouth, that can have a very big impact in terms of your health, your well-being, your ability to enjoy things in life. And we don't think anything of it anymore. So when it comes to taking care of your neck, stretch, exercise, but also very important that if you're dealing with issues, that you have that area properly assessed. Let me show you some of the ways that it can show up and why. First up, this is basic neurology. These are the clusters of cells and the conduits of information that is going between your brain and the rest of your body right at the level of that top vertebra in your neck. You've got messages that come from every single muscle in your hands, your legs, your low back, and back down to the bottom. This is involved with pain sensation. This is involved with pressure sensation. This is involved with muscle tone, muscle tension, our sense of balance and equilibrium. All of this is processed through this particular area. Next, and this is probably my personal favorite picture, these are all of the nerves that are located right up in this area. These are the electrical wires that are going to your different muscles, your joints, your organs. So you've got ones that are going to your tongue, to your throat, sensation inside of the skull, blood vessels inside of the skull. You've got ones that are going to your throat. You've got ones that are going to your neck, to your head, to your shoulders. You also have ones that are going down to your heart, your lungs, digestive system. Again, this is basic neurology about what this area here can actually affect. And this doesn't mean pinched nerves or compressed brainstem or anything like that. No, nothing like that. Think of it more like a pebble in your shoe. Even if it's very small, if it creates friction over a long period of time, it can produce an electrical issue where you start experiencing symptoms in parts of your body that you may never actually realize are actually electrical issues stemming from this area. Very important. Then you've got blood flow. These are a pair of arteries that go up through your neck, take a little loop right around here, and then as you can see, they are supplying all of the vital life centers in your brainstem, in the cerebellum, which is involved with balance, coordination, not just of local effects, but of everything in your body, and also blood vessels that are going to go to the upper part of the brain as well, which are responsible for your vision, motion, sensory processing information, all of this blood flow going up to the head, influenced by what's happening in your neck, but also the blood flow coming back down. All of the blood flow, when you are in an upright position, is going to be processed through your neck, through these series of pathways here. And you can see that the drainage or the plumbing issues, if you have a blockage where things are not flowing 100%, it may not be to the point of pathology. Let's say it's only about 95%. But what that means is you can have a congestion of 5% of fluid back into the brain. This can be related to pressure, especially I feel better when I lie down. This can be headaches. This can be chronic fatigue. This can be chronic pain, because if you affect circulation inside of the brain, it's got the potential to affect absolutely everything that your brain controls, only everything in your body. Last but certainly not least, if you've got this problem in the upper part of your neck, your brain is going to be tilted like this. Brain don't work happy like that. So what it does is it produces compensations by causing muscles in your body to tighten. And the issue with that over a long period of time is that can lead to degenerative osteoarthritis, wear and tear. Arthritis does not happen because we are simply getting older. It's a consequence of things not moving properly in the body, making compensations, but then those compensations starting to wear down over a period of time. And then depending where we hold our stress, whether that's in our head, in our shoulders, in our low back, that's where we can be experiencing our symptoms. Where we experience pain is not always where the problem is coming from in the first place. So there you go, a very quick one through about why and how it is that it's so important to take care of your neck, but also how a problem in your neck can affect so many different things in your body that you may never associate with that particular part of your body. So if you're experiencing these things, please first and foremost, have the normal kinds of tests to make sure you're not dealing with overt pathology, blood tests, MRIs, x-rays, things like that. But if you do know that you have arthritis, or if your tests are quote unquote normal, then you're wondering, okay, well, what do you do about it? This is where it's important to have a look at the health of your neck. If you want more particular information about this, please put your name, put your location in the comments. I will happily reply on these videos here. If you want more information, you can click out or check out my YouTube channel, Dr. Jeffrey Hanna, or my clinic website, clearchirospokane.com, where we've got all kinds of articles, videos just like this that talk about different conditions and how it is the neck can be influencing what's going on. Now, if you are not in the inland Washington, the southern, southwest Canadian areas, or northern Idaho, and you want to find a specialist in this particular field who might be able to help you, there's fortunately a directory. Go to UCC near me so you can find a specialist near you. Thanks for watching this one. Remember, take care of your neck. Why? Because it's your lifeline between brain, rest of the body, can make a profound impact in terms of your health, well-being, and your ability to do and enjoy the things in life you really want.